for a 2-week dose. Right now, it's not clear if it will be covered by insurance. 1 in 8 women suffer from severe depression after giving birth. In our last half hour, we talked about foods that can cause cravings and in some cases, addiction. Our viewers had more questions. So here with some answers is Dr. Michelle DeBlasi, psychiatrist at Tufts Medical Center.
Hey, Dr. DeBlasi, it's great to see you. So we heard what you said at 4, and we saw you at 4, and you've said it before. Eating comfort foods such as mac and cheese, ice cream, anything with chocolate makes us all feel good. So here's our first viewer question tonight. Margaret wants to know, are there substitutes for fat, salt, and sugar that might be healthier and less addictive?
Good question, Margaret.
Yeah, that's a really great question. So we know, just like other addictions to alcohol, gambling, other drugs, that food addictions are real. And certain people are going to be more predisposed to having them compared to other people, depending on their genetics, for example, or their family background or heritage. The things we're going to be craving are going to be things that are delicious, like things with high fat, high salt, high sugar. But of course, there are some substitutes that you can try. I don't think anything is going to replace chocolate, for example.
Right.
But like what? Give us some examples.
Sure. So for example, like if you're making baked goods, instead of using oil, you could use like applesauce, for example. So just trying to pick a slightly healthier option as a substitute, while also still incorporating some of those other foods into it.
How about moderation too, though, right? So you can have the things, but just not as much?
Exactly. So I always recommend to people to have a really well-balanced, nutritious meals, really focusing on having balance. And you don't want to avoid foods altogether, because that can cause you to crave more.
All right, let's talk about our second viewer question. This is from Chrissy. She wants to know, is there a difference between food addiction and binge eating disorder?
Yeah, so they're actually quite similar, but they are different. I mean, the similarities are they actually each have a little bit of an addictive quality to them, and they can actually both happen to you at once. So you can have both disorders. But basically with binge eating disorder, what's happening is you're having these periods where you just have to eat a very large volume of food in a short amount of time. Whereas with food addiction, it's actually specific to specific foods that are triggering it, rather than just having these episodes where you're sort of just overeating and you just can't stop yourself.
So, pardon the simple question, everyone needs to eat, right? So how can treatment help? Seriously, how can treatment help?
Yeah, so it's really important to seek out help if you're having these issues, because there are some really simple techniques that people can do to help change their behaviors, as long as they're motivated for change. Doing things about being more mindful while you're eating, sitting down while you eat, enjoying the flavors. And so what you can do is, if you're having trouble doing that, you can actually reach out to a therapist and do some more cognitive behavioral therapy, which can actually help to address some of the distortions you might have about eating and change your behaviors. And then also there are medications, if it's really serious, that people can get prescribed that can help with cravings. So things like naltrexone or bupropion can actually help with like severe cravings.